Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.
Hello, everyone. I'm Barbara Hamm Lee. On today's Another View on Health, sickle cell disease, or SCD. It's estimated that 100,000 people in the U.S. suffer from SCD, and the vast majority are African American. Recently, the Food and Drug Administration approved 2 new treatments for sickle cell disease, but access and affordability may keep many from receiving the care they need. Up next on Another View, meet Dr. Simone Uwan, an expert on SCD because she has it and is thriving, and she advocates for others who suffer with this debilitating disorder. Another View on Health with cardiologist Dr. Keith Newby. That's next, right after this national, regional, and local news from NPR and WHRO News.
Discussing today's topics from an African American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Hamm Lee. I always like to start with some things that you might be interested in happening in the community, and this one really caught my eye. So EVMS has a program called Teen Health 360. And they have a contest going on. And the contest question is, what does a supportive relationship look like between an adult and a teen? Now, they are looking for narratives, poems, images, audio or video, or mixed. You can mix it all together, but something that expresses how you think a supportive relationship looks like between an adult and a teen. Now, the entries are due by the 31st of January, so you don't have a lot of time to get it done, but the winning submissions will be shared with the public. And there are some prizes. You can get $50 to $200 in Amazon e-gift cards, depending on where you fall. So if you're interested, you'd like to have your child, your teen submit some information, go to evms.edu/teenhealth360. That's evms.edu/teenhealth360. So hopefully you guys will participate in that. And we are so excited. PBS and Dr. Henry Louis Gates, and if you watch PBS and you've seen his documentaries, you know they are outstanding. In February, there is a documentary coming in celebration of Black History Month and also just history on gospel. And it is all about gospel music and sermon and African-American spirituality. Now, that's going to be happening in February 12th and 13th at 9 p.m. here on WHRO TV 15. However, our other public radio station in the area, WNSB, which is Hot 91 at Norfolk State University, tomorrow, January 26th at noon, they are conducting a roundtable discussion in support of this documentary, and they're going to have some of your favorite national gospel artists as part of their roundtable. So we encourage you to tune in to 91.1 FM WNSB Hot 91 on tomorrow, Friday, January the 26th, for that roundtable discussion. And next week on Another View, we will also have a program about the history of gospel music and its evolution to today's version of gospel music. So you want to tune in for that also. So it's the 4th Thursday of the month, which means it's time for Another View on Health with my favorite cardiologist, Dr. Keith Newby, who is also the Market Director of Community Health Improvement and Engagement for Bon Secours. Hello there, Dr. Newby.
And how are you doing today?
I'm doing great. How are you doing?
I missed you.
I know, and Happy New Year.
Yeah, same to you. I mean, I'm just like, man, you put me down in December. I'm hurt.
Don't be hurt. We were off. We were all getting some much needed R&R, right?
Listen, I'm not mad at you. tell you. I don't blame you.
Absolutely, absolutely.
But it's good to be back with you today.
Good. And you're with Bon Secours now, and you guys have a program that's coming up that's going to benefit women. I would assume women and men in Portsmouth. You want to talk to us about that a little bit?
I appreciate that. Yeah.
Sure.
So one of the things that I think at Bon Secours is really trying to push an issue of how do we best serve the community. And one of the things that came up with that they had been working on anyway was getting approval to put a women's imaging center in Portsmouth. Portsmouth is an area that's in desperate need of continued and improved medical care, and they are putting forth that commitment to do so. So they are actually they got their capital improvement. They're working with the city now for a location. They're looking at a couple right now, and they do have the approval to put this a women's center that's going to do screening mammograms, diagnostic mammograms, breast biopsies, breast ultrasounds, even bone densities for the best health for women. It's going to be they have two locations they're really trying to hone in on, but they're trying to make it easy to get to. So they wanted easy parking on the bus line for convenience. They're really doing a good job with this. I have to give them a lot of credit. I've been impressed with. And part of why I wanted to work with them was when they came to me, they were like, listen, we've had some challenges in the past. We're facing them head on. We want to do what's right for the community and the people that we want to serve. And they were putting forth the best efforts. So I have to give them a lot of credit. I've seen some good improvements in terms of just them coming out saying we want to do right for the area. So I have been as impressed with them as I could ever be.
Oh, well, that's fantastic. And I want to encourage all the women, once those centers get set up, and even before then, to make sure that you get those screenings. I just had my bone density screening done, as well as my mammogram, and thank God both turned out okay. So, but you need to get that done on a yearly basis. Yeah.
That's a testament to you taking care of yourself.
Absolutely. I try anyway. Well, yeah, we could talk about that. But anyway, So today we're going to talk about a disease called sickle cell. And according to the Centers for Disease Control and Prevention, sickle cell disease, or SCD, it's a group of inherited red blood cell disorders. In SCD, the red blood cells become hard and sticky and look like a C-shaped farm tool called a sickle. Now, in the United States, it primarily affects African Americans. The FDA recently approved 2 new treatments for SCD, but they're very expensive, and not readily available. So joining us now to talk about SCD from a very personal perspective is Dr. Simone Uwan, or Dr. Simone, as she's known in the sickle cell community. Dr. Simone, how are you?
I am well today. Thank you so much for having me. It's great to be here.
We appreciate you being with us. And, I was so curious because we know that sickle cell is an inherited disease. But as I'm reading your bio, you weren't diagnosed until you were a young adult, right? So why so long for the diagnosis?
I am finding out that a lot of people are like me. So I have, there are many different types of sickle cell disease. So I have what's called sickle cell SC genotype, and that tends to be one of those that you seem to be able to compensate a little bit while you're growing up, and then in your early adulthood, sometimes even in your mid and in a few cases late adulthood, it can present itself. So unlike hemoglobin SS, I have heard of people presenting later in life, but it's less common to be so.
So can you describe for us, what you feel, how you feel, what does having sickle cell mean?
Oh, my goodness. That's a very loaded question. On any given day that I'm in a crisis, I feel like, first of all, I'm probably in a fetal position begging for my life.
Mm.
And it feels like, someone that's drowning, how they will just make deals like, God, if you save me, I will be good for the rest of my life. That's kind of the despair that someone feels when they're going through a sickle cell crisis. It's time-sensitive tissue injury on the level of the bone and in the vessels and anywhere that blood flows and it can be blocked by these sickle cells, you can have tissue injury. And when the cells are dying, they send signals out. They essentially are screaming to say, please help us, we're dying.
Wow.
And that's the same kind of sensation you get when you have a heart attack. In fact, the physiology is very similar. So in a heart attack, you have a clogged vessel. It's clogged from plaque. Ours is clogged from sickled cells, but essentially the end result is the same. The tissue gets damaged because there's lack of blood flow, so there's lack of oxygen delivery and nutrients to the tissue of the heart muscle. And so people, will tell you that they feel like there's an elephant on their chest and there's a feeling of doom, that, they feel like they're going to die. And so they present to the emergency room, and it's a quick intervention that has to happen to be able to rescue as much tissue as possible, right? That's the same thing essentially that's happening with sickle cell disease, except it is everywhere that blood flows. So it could be as inconsequential as your pinky or your hand, and it can be as devastating as your lungs, your heart, your brain, your kidney, any organ. Take a pick.
Dr. Newby, you want to jump in?
Yeah. Well, a lot of what she was saying is definitely on point. We in the heart world, I have to deal with a lot of sickle cell patients because of their presentation. They come in short of breath or have chest discomfort, and sometimes you have pulmonary emboli or embolic events in the lungs, where they'll mimic that. And it's a devastating disease. And I of course, I don't have sickle cell. I don't have anybody in my immediate family with that. But just dealing with it and watching people and the kind of pain they endure, it is devastating to watch. And it's not a pleasant experience to watch them suffer. Like you can see that suffering occur, and unfortunately, so. And the biggest issue to me, the reason why I'm a big advocate is, this because it seems to, of course, predominate in the African American community. You don't see the level of research and things done like you will see for other disease processes, and that part can break your heart because you're like, everybody's a person and they should be treated accordingly. And this is a devastating illness.
Dr. Simone, you were practicing and you found yourself in a different role. Because of your illness, you wound up not practicing anymore, but now you're advocating for other sickle cell patients.
That's correct.
Right?
So, yes, that is correct. So it came to a point where I had 5 hip surgeries and couldn't get my hip to cooperate with the rest of my body, and at the same time returned to using portable supplemental oxygen. Things just, I felt like my spirit wanted to go, but my body was saying, feel free to go wherever you want. We're going to stay in the bed. And so essentially I had to cooperate with that. And it was really a hard transition to find purpose again. When you have trained for so long, gone to, I trained at Stanford University School of Medicine. It takes a lot of money, and then you practice and you love what you do. I used to find ways to include sickle cell patients in my patient population as I was practicing because I wanted to give them the care that I knew they didn't get elsewhere. And I loved doing all of what I did. So when I lost my ability to work, it was It was definitely life altering for me. But I did a lot of soul searching and reached deep for my faith and repivoted and started to see, I started looking for support groups on Facebook and then saw all these, patients telling, in the privacy of these huge groups of like 20,000 and 10,000, telling you of their experience in the emergency room. And it was horrendous. Like people were recounting, and sometimes even videotaping because they could, being kicked out of the emergency room because they were crying too hard. I kid you not. Because they didn't want to go home because they were scared. They were feeling so much pain, and someone was telling them that their labs looked normal, but they knew that they were not well, and so they were begging to please look at me a second time, please readmit or admit me, and they would end up in a feud with the doctor. Essentially, security would be called, or the police, and they would be exited out by the police. And it was just heartbreaking to watch. I couldn't believe it. Like, I knew that I had my share of discrimination in the emergency room, but it was never on the level of being escorted out of the emergency room.
Right.
And so I thought, you know what? I know how to advocate for myself. My husband, I've been married 26 years. My husband is always there by my side, but he will tell you, he never advocates for me because I know what to say and how to say it in order to navigate the healthcare system. So I thought, you know what? I am still blessed to have this knowledge. I'm going to use it for good. So I decided to start a nonprofit organization where I essentially have a curriculum-based program. The first part is encouraging just regular volunteers from the community that are motivated to learn, and I teach them the NIH guidelines, the American Society of Hematology guidelines on how to manage sickle cell disease in the emergent setting. And then a lot of them already are familiar with sickle cell disease, so you're not teaching them anything new there, but it's just the management. And so then they are paired with patients who are calling in and asking for help when they're going to the emergency room or when they're in the hospital. And so then we will connect with the providers and very respectfully, engage them to say, hey, I'm not sure if you're aware, but you can also do this, this, and this according to the guidelines. We're not diagnosing or prescribing anything. We're simply making them aware of the guidelines that already exist, but nobody uses.
Well, you were saying that even in some of the materials I was reading, you were saying that even different hospital systems, some have a protocol for how to deal with the sickle cell patient and what they need to do, and others don't. So it's not even universal across the board, is it?
Nope. No, it's not. So you can go to one hospital and get, standard of care treatment, and you can go to another hospital and sit in the ER for 6 hours with a time. No one with a heart attack would be allowed to sit for 6 hours with that tissue injury, right? Uninterrupted, unaddressed. But a sickle cell patient would. They could sit there for 6 hours, and people will have the audacity to say, we'll get to you. We have other more urgent patients to take care of. And people have passed out, had strokes, had tissue damage in the emergency room while they were waiting to be seen because they weren't seen on time. And unfortunately, I wish I was recounting things that I didn't personally know about, but I know each of these things that I'm telling you about. I know patients that went through them, and some of them I intervened for. So it's not good out there. It's not consistent, and even the ones that may know how to deal with sickle cell, they often think that they know all of what to do. Like yesterday, I was talking to a doctor, and he says, "This is not my first rodeo And I said to him, so then if it's not, why is the patient not on an anti-inflammatory? Sickle cell is known as an auto-inflammatory disease now. So why are they not? And then, by the end of the conversation, he was totally in agreement, started the anti-inflammatory, started hypertonic saline, which was another recommendation. And so, there's a lot of teaching that needs to be done when it comes to management of sickle cell disease.
757-440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. I would love particularly to hear from parents of children who have sickle cell, since this is an inherited disease. And how are you managing? And would an organization like Sickle Cell Medical Advocacy, Inc. Help you in terms of advocating for your care? Dr. Newby, let me ask you this. We hear, and it's been documented, this bias in the healthcare industry that Black people can take pain more so than anyone else. Do you think that's part of why some sickle cell patients may be treated the way that Dr. Simone just talked about?
Partly, yes. And if we're going to be real in the conversation, I think a lot of it is just people just don't care. And a lot of times what happens, and it's unfortunate that people come to the emergency room and they get treated as if they're just drug seeking. And that's the unfortunate reality that you run into. And if you're African American, you will see some biasness in that regard, thinking that somebody's just there seeking drugs. I want to just say, let me put sickle cell in you for a moment, let you see how it feels, and then come back and talk, because it doesn't have to be just narcotics. A lot of times people just say, I just need some help. They're not doctors. They're patients just trying to feel better, which is what most people want to feel. And that may be and it's going to be a combination of things. It won't just be narcotics if that's necessary. And a lot of times narcotics are just given just to mask the pain while they're trying to get the other aspects in line. You got all this sickle cell, these sickled cells causing damage. That's where that hypertonic fluid comes in, because you're given higher sodium content fluids, because you're trying to make all the fluid stay inside the vessels to try to dilute all that out. So that's what helps to open that up, because again, you have to avoid dehydration. It's a conglomerate of things that have to go into play when you're treating these patients, not just one thing. So, I think there's a lot of biasness in it. Some of it is people thinking people could take more pain, but some of it is folks thinking you're down there drug seeking. They don't really understand sickle cell disease. That's why I thought this conversation was important, because again, it's like Doc just mentioned about that doctor saying this is not my first rodeo. But if you don't really understand, you may have been dealing with sickle cell patients, but that doesn't mean you know how to treat sickle cell patients. There's a difference. Yeah, absolutely. And that's where that educational part comes in, and that's where I think we've fallen short in the medical community. We've just like the forgotten group of people, unfortunately so, and that's where I think we need to change that.
So, Dr. Simone, the disorder is inherited, and you have to have both parents with the trait. Now, my daughter has the trait. And I'm wondering, particularly since this affects so many African Americans, should we be, how when you go down to get your marriage license, or you decide to have a child with a partner and so forth, should there be a rule to have both tested? And, are they
don't
guaranteed?
Get me on my soapbox about that. Don't get me on my... Yes, the answer is yes, even before you finish the sentence. Yes. And not only that, but people should, I was just at Be the Match the other day and speaking, for them. And I said, part of the problem is you have people that are immigrants that if they come in the United States, you're tested at birth, right? But then there's not another checkpoint. So what if you're not born here and you come in? And you don't get checked? What if, you come in and you didn't get checked, and you go to school and you're, trying to do sports? Can you get checked? Can you get checked when you start, maybe high school and college? Can you then get counseling? I remember vividly when I was diagnosed, it was in college, and they told me, it looks like you have the trait, so you don't have to worry until you're getting children. And that was that was the one-liner. And at 19, I'm thinking, well, I'm not planning on having children anytime soon. So that just went in one ear and out the next, right?
Right.
So yes, if you were getting a marriage license, that would be another time to do. And I think back in the day, they did do blood work and check for things before you got married. These days, there's not really a clear mandate to do that, but that is my soapbox. I absolutely believe that prevention is key.
So because the trait, if you have the trait, you don't necessarily have any symptoms. Is that correct?
On average, you don't, but more and more, and it might just be the stressors that we have in our society. More and more people that are diagnosed with the trait are having symptoms, and it's really crazy because then they present to the emergency room, and they are, and they say they have the trait, and people look at them like they have a third eye, like you shouldn't be having any symptoms. Now, I will say this: some of them are actually misdiagnosed, right? And they may have sickle beta thalassemia. Those are two different, chromosomes entirely. It's like, same neighborhood, wrong street. So they may be checking for sickle cell, but they may not be checking for thalassemia. And so if someone has beta thalassemia trait and a sickle trait, they now have sickle beta thalassemia, and that's a disease, right? And that is a form of sickle cell disease. So a lot of these things are getting missed because, in part, we're not testing accurately. And then in many cases, we're not testing at all.
Oh, okay. If you're just joining us, we're talking about sickle cell disease with Dr. Simone Uwan, CEO of Sickle Cell Medical Advocacy, Inc., and an SCD thriver. And my co-host for the hour is cardiologist and market director of community health improvement and engagement with Bon Secours, Dr. Keith Newby. 757-440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. Do you have sickle cell? How are you coping with this disease, and how are you thriving? Let's talk to Allison in Florida. Hi, Allison. You're on the air.
Hi.
Hi.
Good morning, everyone, or afternoon in time zone.
What's your question or comment?
My comment is just for everyone listening, and I just wanted to extend my support to Dr. Simone. I'm a caregiver. I went through her program with SCMA last year, and was it July and August, and it was an eye-opener for us. My daughter is 8 years old. She has sickle cell SC, the same variation that Dr. Simone has. And so she went from having, for the previous year, she had pain crises monthly where we were in the emergency room. And now we're at a point where, she hadn't had one for 6 months, but we did have one over the weekend. And Dr. Simone was right there with us. We have a whole team that was able to support us, and my daughter was in there for the weekend, but she's back at school now. But she's a godsend, and her team is a godsend. We literally need this in every single hospital, in the country.
Wow, Allison, I want to ask you, as a mom, how do you cope when your daughter is going through her pain crisis with this?
Well, I have to stay focused, and that's what was missing, I believe, in my knowledge, because I didn't have any knowledge of anything prior to this, and so it was kind of trial and error. But having the information, knowing the guidelines, knowing what to request, just one point about using half normal saline when you're having a crisis is so important to helping them, get back, quickly and not have as much organ damage, like she was saying. So in order to cope, I have to stay focused. I have my binder with me at all the time, at all times. and just stay calm, and just know that you have a support group.
Mm-hmm.
Having support is just tremendous.
And how did you explain this to your daughter?
She's very inquisitive. My daughter is she asks all the questions, and I think most kids that age do. And so she understands about her sickle cell. We talk about it in a way to make it seem, for her to understand that, it's okay to talk about it. It's okay for you to cry. It's okay for you to ask questions. She asked me, why did you and Daddy do this to me? And I unfortunately didn't know that I had the C trait. And so that was something that, like Dr. Simone said, we need to know ahead of time. We need to have genetic counseling when we're in our child-rearing ages, before we have kids, because I didn't know. And so, she asked a lot of questions, and I answered them best I can. But she has a sense of humor with it as well. She's definitely doing her best, and we have her in therapy. So it's just it's a comprehensive situation right now.
Allison, thank you so much for calling in. We really appreciate it, and we wish the very best for you and your family. Dr. Simone, Dr. Newby, either one of you want to respond?
Listen, I'll let Dr. Simone take that one.
It was a nice surprise. I promise you, I didn't know that, but it was a nice surprise to hear Allison there, and like she said, that's the other thing, like. Hemoglobin C disease. So by itself, it's pretty benign, but then you pair it with the sickle gene, and you have another variation of sickle cell disease that is life-altering. Yeah. And so when people are born, they're just testing for sickle. That's it. They're just testing for the sickle gene, and you have one, and they say, oh, you have the trait, and they've never tested for C, they've never tested for thalassemia, and so all these other people are getting are being overlooked. They're not being diagnosed, and they're having to find out in a very rude way later on in life.
Yeah, I want to talk about the 2 new treatments that the FDA just approved, but let me take one more call very quickly. Denise is calling us from Orlando, Florida. So glad that we're like spreading out across the country. Here we go. Hi, Denise, you're on the air.
Hello. How y'all doing?
We're doing good. What's your question or comment?
Well, my comment is that I'm just so grateful to have Sickle Cell Medical Advocacy. It has saved my life tremendously. I'm speaking from 39 years old, and they told my mom I wouldn't be able to see the age of 2. I was diagnosed at the age of 1. Spent my first 5 years in and out of the hospital, mostly in the hospital. But throughout my life, I've dealt with strokes and different things like that, and just trying to keep going, where I did not have like that kind of support there, because my mom used to always be there, but they said that I needed to try to learn how to do it on my own, because my mother was sickly a lot. So therefore, I had to start trying to take this journey and try to just push. And I was in a situation in a hospital, and I was there, and I would just cried out on Facebook, like, hey, can somebody help me? And they gave me Dr. Simone's number and was like, hey, she would like to talk to you. And I mean, when I tell you, I thank God for that, because she saved my life. Literally, they were diagnosing me with pneumonia when I had acute chest syndrome the whole time. And I'm like, oh my God, I'm about to die. You know what I'm saying? Like, these people don't know what they're doing. But just like I said, by God's will, Dr. Simone was able to get me from out of that hospital, get me to another hospital where the doctors would listen, and they listened to everything. And this happened like about 2-3 times. So Dr. Simone, oh my God, deserve all the awards. There he is. You know what I'm saying? We got to make sure that she stays great, and we help, as much as we can. Sickle Cell Medical Advocacy, donate, y'all, do what you can, because it is helping a lot of people.
Thank you so much, Denise, for the call. We really appreciate that. Dr. Simone, you've got a big fan club out there. You're helping folks.
I'm over here blushing because I know you will think I put these people up to this, but I promise you I didn't. Oh my goodness.
Well, actually, it's interesting because I'm looking at our board, and we've got calls from all over the country that are starting to come in. But before we get to that, Dr. Newby, I'm going to ask you, you've done some research on this also, but we do know the FDA just approved 2 treatments. But what struck me was how much they cost and how few medical facilities will actually be able to do the treatments. And so it doesn't sound like a whole lot of people are going to get a whole lot of help from this. Am I misreading that?
Not really. And hopefully, though, there are, I think pushing government to start, and insurance companies to start paying for this stuff, one of the downsides, I think we give insurance companies a pass more often than we should. I think we don't advocate in the hospital systems to get things done. I mean, things can be accomplished. I mean, the only people that's really making out the drug companies and insurance companies. Either insurance companies say they don't want to do it, drug companies charge a bunch of money to make it, and that has been a problem. But, I think just with advocacy and diligence, and that's the issue I think we don't do as much of as we should, is if we're diligent with it and push the envelope, I think the ability to have access to this, because some of it now, again, Dr. Simone would know better than I, but it sounded like there was some potential for cure, possibly, if you get the right genetic, mix, or however this is almost like a genetic altering, because you're trying to create.
They're talking about editing, editing the gene. Yeah. Go ahead, Dr. Simone. What do you think about these two treatments?
So there's Vertex's Excel or Casgevy, and that one is a gene editing with CRISPR-Cas9 enzyme, and that one costs about $2 million. The other is by Bluebird Bio, the Lovocell, and that's a lentiglobin that actually is a lentiviral vector. So essentially that's correcting the DNA in the stem cells and encoding a modified beta globin gene. So it ends up producing a non-sickling hemoglobin. But, the price tag is huge. So I think for Bluebird Bio, it's $2.2 million. Now, here's the thing, though. I was looking at some of the other rare diseases and what their price tags cost, what their drugs cost. And Bluebird Bio has a thalassemia therapy called Zynteglo that's $2.8 million for a one-time dose, right? Unicure has a $3.5 million drug called Hemgenix, and it's for hemophilia B. And so when we start looking at these dollars, we do have to look at what other things are costing that are like for similar diseases, like rare diseases that tend to have, someone who's essentially peering out the window, looking at life, passing them by, not able to play in the game, and then someone comes and offers something that says, not only can you go out there, you can play in the game and you do not get hurt, right? And so I think that they are pricing it based on that, like what's the cost of life. Now, that's their job. Their job is to get as much money as they can because they're a pharmaceutical company. Our job is to knock that down. Our job is to lobby for getting, this therapy by any means necessary because our lives depend on it. And so we will lobby with the insurance companies to cover as many patients as possible, and so on. And I never look at the price point of anything as a barrier. I have had many times when I needed things, and I just in faith said, you know what, I'm getting it, and I have. And it almost seems like I bypassed the money and got the thing itself. So I am hoping that, each day that every sickle cell boy and girl gets up and does their best, plays that game the best way they know how. It takes a little bit of crazy to play that game without a treatment, but with a constant lobbying for that price tag to be brought down or subsidized in some way. Sickle cell is a heavy burden on the federal government. And so if, the Center for Medicaid and Medicare Services, if they were to have a subsidy for these procedures, I think that it would actually be cost saving for them when you think of how much it costs to manage a sickle cell patient over life that then can't go out and work and be a productive member of society and pay tax dollars.
Yeah.
But if you can get somebody well and they can go out and work and pay tax dollars, then you've actually invested well. And so our job is going to be to persuade them to think that way.
Okay.
Well, I'll tell you though, Barbara, the thing to me though is what my biggest issue is. I say, where do you come up with this price tag from? Give me your math that you use to charge somebody $2 million for a drug. I'm like, that's the only downside to me with the medical care, in the medical world is you feel like, I'm not saying people shouldn't profit on things. Don't misunderstand. But when you talk about people's lives, that's where there has to be some middle ground to say, you came up with this price tag. Walk me through your dollar value, kind of logic.
Well,
and then you can start seeing, okay, is this really cost that much, or is this, you guys just come up with a price tag, just pulled it out of the air.
Well, the other thing, too, is that not many medical facilities at this point are trained to actually administer and actually do the treatment. So
That's
right.
right.
On top of having the $2.1 million in terms of how much the procedure treatment would cost, you still would have to travel. More than likely, you have hospital stay. There's all these other things that doesn't, at this point in time, make it the miracle drug that kind of the headlines may have presented in terms of the articles about this, mainly because a lot of the people who need it won't be able to access it. I remember reading I believe it was in the New York Times article, there was a gentleman who was saying that if we did 10 of these, the state would go bankrupt because most of the patients are Medicaid patients, which means that the state pays for it. That's the insurance. So, there's that conundrum. But I hear you, Dr. Simone, when you said we have to advocate for folks. We got some more calls. Let's run to Karen calling us from Omaha, Nebraska. Hi, Karen. You're on the air.
Hi, Dr. Simone. I said, admittedly, I know Dr. Simone well. I'm on the board. But I found Dr. Simone on Facebook because I actually have a foster son that has sickle cell, and he came into my life as he was aging out of the foster system and aging out of pediatrics for his care. So I really had to crash course learn so much about sickle cell, and the treatment he's received in the hospital has just been awful. And I will say there's a lot of racism and bias, and I'm a white woman and have never experienced the care that he has. And we are one of those people that my son had a infected vegetation in his heart valve and had MRSA, and we had security escort us out of the emergency room. If we hadn't gotten to another hospital, he would have died. So, yes, I'm lucky that we have advocacy, but there's so much more that needs to be done.
Karen, I'm just curious, what did security say to you? Why would they escort you out?
Well, because we wanted a second opinion, because he knows his body better than anyone else, and he kept on saying, no, I'm not here drug seeking, I really need care. And they thought he was just trying to get opiates, and we asked for a second opinion with the doctor. They told us there was no doctor in the ER to talk to us for a second opinion. We were going to be discharged, and because we wouldn't leave for discharge, they made sure security came in to take us out.
Wow.
Remember I was telling you earlier about that issue of how they treat certain patients, and they'll think you're just drug seeking?
Yeah, that's exactly
that's to my point.
What she's talking about. Absolutely. Karen, we wish you guys the best. Wish your family the best. Thanks so much for calling in. We appreciate that. Let's talk to Kimberly in Detroit. Hi, Kimberly. You're on the air. Okay. Apparently, we're having some technical problems. So, Dr. Simone, where do we go from here? I mean, if you are facing if you're a parent and you've just been told that your child has sickle cell disease, give us some advice, give us some practical things to think about. What should they do?
Well, the first thing I would say is don't do this alone. This is really too much to do alone. I I wrote a couple of books on sickle cell disease, and the second book, I talk about, it's called All Right, the sickle cell community versus the medical establishment. And I talk about this. I say, we need to operate in groups. We need to operate in communities, and that's the only way that we can get information to pass quickly, and to get everybody in line. I mean, case in point, you just gave me this link to this radio show like less than 30 minutes ago, right?
Yeah.
And I just went to my community and said, hey, I'm going to be, doing this, and everybody got the memo. So, if we operate in community, we can get people the help they need. We can get them the support they need, the advocacy they need. They don't need to go to the hospital by themselves when they're not understanding anything that the doctor is saying to them, or to the emergency room to be told that they're a drug seeker. Even this young man that Carol was talking about, he left being escorted off the premises and went to another facility and was admitted to the ICU and found to have a vegetation in his heart and needed a surgical procedure to remove that vegetation. So it's like, we don't want to have people doing this alone. It is just too much to bear alone. So the first thing I would say is to please reach out. Please operate in a support system that knows about sickle cell disease, and the rest you can learn from there.
Okay. Let's see. I think we have Kimberly back from Detroit. Hi, Kimberly. You're on the air.
Hi. Can you guys hear me?
Yes, we can. Okay. Go ahead with your comment. We're almost out of time, so moving along.
Okay. I just wanted to make a quick comment about Dr. Simone. I think it's such a wonderful thing that she was able to push through all the trials and tribulations to create this format for us to connect and fight for each other. She's provided so many different avenues for us to heal. For instance, I am one of the advocates, and I'm into holistic healing. So when somebody's in a crisis, Dr. Simone will let me know, and I'll talk to the patient and do breath work with them, EFT tapping, and just hear them out so that they know they are alone. And it seems to have been very helpful and touched a lot of people. So I just wanted to come on and thank Dr. Simone for all the work that she's been doing.
Kimberly, thank you so much for calling in, and also thank you for advocating for others. As I have gone through having to be an advocate for a family member, I know what that's involved in, what is involved, and it's a lot. So the fact that you would volunteer to do this is very, very special. Thank you so much for doing that. Let's see if we can get one more call in before time is up. Maurice joins us from Norfolk. Hi, Maurice, you're on the air.
Hi, thank you for taking my call. I wanted to bring up the how the reason why the sickle cell treatment is so high. The pharmaceutical companies say they have to recover their research and development, but I heard in reality a lot of research and development is taxpayer funded, and they have to recover money that they really didn't lose in the first place. And it's like it just gives more of a cause for having universal health care in this country and it's not doesn't seem like it's going to happen. I mean, we're the only developed country that doesn't take care of their own people.
Okay, Maurice, thanks for the call. Dr. Newby, I don't think you would disagree, huh?
Absolutely.
from that perspective.
That's the unfortunate reality of capitalist society.
Absolutely.
It becomes about money.
Dr. Simone, we've got just a few minutes left. I'm going to give you the last word, and then I need to go to Dr. Newby because there is an actual blood drive for sickle cell that's happening in our area, and we want to be able to promote that. Yes, definitely. But any last-minute words you'd like to say to the audience about sickle cell?
Well, no, I would like to say for anybody that is wanting to join forces with us to help us, we are a nonprofit organization. I am a volunteer. We are in our second year, so we're not at the point where we're able to pay anybody. But we do this because we love the community and we know what it's like to walk alone, and we don't want anyone else to do so. And so if you can help us in any way, especially doctors who can volunteer some time, I can teach them what is needed. More than anything, I think that's, what we need first. And then, any other, if you can't help by volunteering, help by supporting us financially. Our link is www.sicklecellmedicaladvocacy.org, and we'd love to have you.
Okay. Thank you so very much for joining us. And we wish you the very best also, in your health journey. Thank you for that. And Dr. Newby, tell us about the blood drive.
So it's a partnership between my church, Historic First Baptist Church on Butte Street in Norfolk, right across from Scope, American Red Cross. We're doing a blood drive. It's at the Murray Center, which is 455 East Bramilton Avenue, 23510. And it's on Wednesday, January 31st of this year, of course, 10 a.m. to 3 p.m. And we are doing this to really make sure we have that's needed for those sickle cell patients who may need blood transfusions. And, of course, we try our best to not need that if we can in any situation, but sometimes the need is there. And those that come can get a $20 Amazon e-gift card for those that come and volunteer to donate. So please come out for that. And one last thing I wanted to say is, and one thing in our community, we don't talk to each other in our families about our health conditions.
Yes.
This is like, if nobody else listens to anything I say today, talk to each other, make sure each other knows, because if you find out there are sickle patients in your family that you may not know are there, that may drive you to say, okay, let me make sure I get myself tested. So just talk to each other, please.
Honestly, it's true. We really do, because we don't share our family history. And we talk a lot about, you and I have had this conversation about around the holidays when we're all together and everybody's talking about everything else. But we need to really be talking about these health issues. But so I have one other question for you, though. With this blood drive also, that if you give between January 1 and the 31st, you get a chance to win a trip for two to the Super Bowl.
Yeah,
what?
Super Bowl,
Are you putting that up?
Yeah. Oh, Barbara, you're such a comedian, I'm going to tell you. I love your sense of humor. You are just a bomb. And I won't say anything further on that one. I'm doing that hidden support. I'll just say that.
And then our last 30 seconds, how's school?
Oh, everything's great. Of course, I told you I keep signing up for different programs.
Yeah,
so
I know.
I know. So in addition to the public health degree, I'm out in a chief medical officer program at Emory, which was my initial, after I finished medical school, I went to Emory University in Atlanta for my internship and residency. So I'm doing a chief medical officer program there, in addition to, of course, to my public health degree at UNC. So I am always
You're always busy.
Learner. What can I say?
Well, I really appreciate that you can give us an hour every month to help us all make our health better. That's Dr. Keith Newby, our favorite cardiologist. Thanks so much for joining us. And thank you, audience, so much for inviting us into your space for the past hour. Do me a favor and share Another View with someone you love. Go to anotherviewradio.org and download the podcast. And while you're there, please sign up for our eView newsletter, which is a once-a-week reminder of upcoming shows. Next week on Another View, the history of gospel music. Get ready to shout, y'all. And this is in preparation for the documentary by PBS called Gospel. And tomorrow at noon on WNSB, which is Norfolk State University's public radio station, you can go there to hear their roundtable discussion in support of gospel. Our theme music is an original composition created especially for Another View by Jay Sennett. Lisa Godley is our show producer. Jordan Christie is our audio engineer, and Dr. Barry Graham answered our phones. I'm Barbara Hamm Lee. Have a fantastic weekend, everyone, and let's get together again next Thursday at noon for Another View.
Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever, whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.